Hello all, this is Dr. Shilpi Reddy and we're going to discuss today about the causes of female sexual dysfunction, FSD. When we have to talk about the causes of female sexual dysfunction, it can be because of the stage of life that she is in. One reason as a stage of life, it can be because of pregnancy, it can be because of post-pregnancy childcare and premenopause, menopause and postmenopausal issues that she's dealing with. They can be one of the causes of female sexual dysfunction. And the second cause can be the physical diseases that she's dealing with. If the woman has a chronic illness and maybe because of cancer or diabetes or hypertension or kidney disease or any chronic vessel blocking diseases, she can have an aspect of female sexual dysfunction where because of the illness that she's dealing with, she is very reluctant and she is actually not having any a desire to have sexual activity. And there are women who are on certain medications which can be one of the reason for female sexual dysfunction. Like there are some medications like antidepressants which do cause a very much decrease in female sexual arousal and all that. So antidepressants can cause female sexual dysfunction. Hypertension medications, that is BP medications, antihistamines, antihistamines can also cause female sexual dysfunction. Chemotherapy drugs, anti-hypertension, that is the BP medications. When women have chronic bladder problems and they take bladder problem medications for urinary incontinence and all these things, they can also have a role play in female sexual dysfunction. And there are several other causes of female sexual dysfunction like hormonal causes. When we talk about hormonal causes, any situation where there is a decrease in estrogen level in the body, they can cause female sexual dysfunction, especially menopause, where there is very low estrogen level and absolutely no estrogen coming from the follicular growth. In such conditions, the genital tissues definitely atrophy, they get thinned out. There is an aspect of very low sexual desire also. And decreased estrogen again causes very less blood supply to the pelvic organs. This in turn decreases the genital sensations, and also they need a lot of time to get arousal and also orgasm. In such conditions, when there are hormonal reasons like estrogen deficiency, then there is an impact also on the vaginal lining that gets thinned out and very less sensitive and less elastic also, and because of the inactivity that they are having. And these kind of things also are one of the reasons for female sexual dysfunction. And if they are not sexually active with thinned out vaginal lining and elasticity is not, again it in turn causes more pain and in turn causes more fear and in turn causes more, it's more prone for infections because of breakouts. So one is related to the other and the other is related to other. It's a vicious cycle. So to break the vicious cycle, definitely your well-being is very important. You should be able to take care of your health in a particular fashion so that you do not enter into the cycle of female sexual dysfunction. And whenever there is any pain associated with intercourse, then again there is a problem of withdrawal from the act of intercourse. And low desires with decreased hormones are one of the major factors for again causing female sexual dysfunction. And at times there are 2-3 factors that are actually working at a single time. Maybe physical diseases along with menopause, along with medications, along with hormonal issues together causing the aspect of female sexual dysfunction. Anything when the causes are identified, management is definitely based on the cause identified. So it is obviously that we go to the reason why this problem has come with a little difficulty, but then when we reach the reason, definitely the therapy and treatment options are very, very good.